So welcome everybody. Thank you very much for joining us today. We're really excited to be welcoming you to this evidence-led research skills training curriculum. This is our final workshop and the end of a really long process in this research. So Pascal, over to you.
Good afternoon or good evening, everyone. So I would like to first welcome you to this implementation workshop on behalf of TDR, the Special Program for Research on Training in Tropical Disease. For us, it's an important meeting. It's the end, or perhaps we can discuss a little bit later, the starting point of a new activity. But for us, it's the end of work that started, I think, a little bit more than 2 years, and we have the final step. And the most important output that TDR and the Global Health Network would like to get for this implementation workshop is just to identify the best way for implementing this essential research skill training curriculum for health research in the fields. And your help will be really appreciated during this meeting, just for us just to understand, but also to identify how to implement this in the field. And I will stop here because I would like to give some more time for the discussion and to identify this solution. Thank you.
Thank you. Thank you, Pascal. Good morning and good afternoon. I hope you can all hear me well. My name is Arantxa de la Horra, and my role at the Global Health Network is to coordinate the research project, and I'm delighted to be part of this exciting project. I will spend the next few minutes providing an overview of the process we have followed for developing an evidence-led essential research skills training curriculum. Next slide, please. From the beginning, the aim of our project has been to find consensus on what constitutes the minimum set of skills, knowledge, and key principles that would enable those without previous experience to undertake high-quality research for health. This research has now concluded a complete curriculum for health research studies in the form of a set of training modules. Today, I will be presenting the steps we took to identify this essential set of training modules that will form the essential research skills training curriculum. In this workshop, we would like to invite you to think about where you work, about your research group, about your institution, and think about how can this training work for you. This is the most important part of the workshop. Next slide, please. And now let's start with our methodology. We designed a three-stage approach. The first stage was a knowledge gap analysis. The second stage was a Delphi consensus study. And stage 3 was a stakeholder ratification workshop. Next. And the first stage, the knowledge gap analysis. In the Delphi's first stage, we aim to identify a list of potential essential research skills. To identify this list of essential skills, we reviewed and analyzed survey results and feedback from over 7,000 researchers from 153 countries. This data was collected between 2017 and 2019. Next slide, please. These participants were in some cases independent researchers, and some were partners from the two preparedness networks that we work with, Ready and Alert. These surveys were designed to identify barriers and enablers to study conduct, to accessing research skills, and recommendations for change. We compiled the data and conducted quantitative and qualitative analysis, and we identified 98 essential research skill themes from the researchers' responses that would become the categories evaluated in the Delphi consensus study. Next slide, please. Once we had identified a list of potential essential research skills, we moved to stage 2, the Delphi technique. The Delphi technique is a consensus building method that gathers experts to discuss issues. The process goes through a series of cycles. In each cycle, a panel of experts is presented with a set of statements to rate, and feedback is then given that shows how each individual's rating compared with the whole group's rating. One of the main advantages of the Delphi technique is that a large number of individuals across diverse locations and areas of expertise can be included anonymously, and this way avoiding domination of the consensus process by one or a few experts. And also, keeping in mind that we are living through a pandemic, it allows us to continue with this project. Next slide, please. Our first step was to select the panelists that would review the themes identified in the knowledge gap analysis. We identified panelists by two methods. One was crowdsourcing and the other one was targeted invitation. We aim for our panel to be formed by both experts and stakeholders in in health research and in health research training, with a wide range of expertise and from diverse geographical locations. We had 594 expressions of interest from the crowdsourcing, and we invited 65 research experts from the targeted invitation. We were aiming to include the views of researchers, research training facilitators, members of research advisory committees, research funders, authors of peer-reviewed research training papers, authors of research training books and programs, journal editors, research policymakers and regulators, and research participants. Based on the research expertise, we invited 414, that was from the crowdsourcing. And in the first Delphi survey, this was completed by a total of 254 panelists. And the second was completed by 222 panelists, giving us an 87% retention rate, which was really good. Which is, and we especially appreciate given the timing and the difficulties that COVID has been causing around the world. And just to note, we conducted pilots for both Delphi rounds. Next slide, please. This figure illustrates the distribution of the different panelists' research roles against the country of work classified by the World Bank income groups. To facilitate interpretation, we group panelists' current role into 4 categories: expert, stakeholders, members of a research team, and other. It's important to note here the proportion of stakeholders. We had 3%, and this will be relevant later on. And just to clarify what we classified as other, we included in this group research participants, students, and those that deemed themselves as other when they completed the surveys. Next slide, please. This slide shows the evolution of the themes that were identified. We started with the 98 themes identified in the knowledge gap analysis. Then in Delphi survey round 1, themes were scored on 2 dimensions. First, relevance. Should we include this category or skill at all? And this was scored using a 7-point Likert chart. And secondly, in clarity, is it clear what the theme reflects? Regarding relevance, 43 themes achieved a level of consensus for inclusion of 85% or more, and these themes were deemed to not require further evaluations from the panelists. About clarity, regarding clarity, 90 themes achieved a score of 80% or more. 10 new themes were identified by the panelists, and the themes highlighted in yellow on the slide were reviewed in Delphi round 2. So that includes the 55 themes from the relevance box, the 8 that were indicated as unclear, and the 10 new ones. In round 2, themes were scored on a yes/no nominal scale for both relevance and clarity. And in addition, we use hierarchical cluster analysis with round 1 scores to determine whether there were obvious patterns in responding related to country, income classification, year of experience in research, current role, and gender. No obvious clusters were identified which would support the generalizability of the findings. Next slide, please. Following The Delphi survey round 2, all themes had been scored by the panelists, and the level of agreement between panelists or experts was translated into levels of recommendations for inclusion in the essential research skills training curriculum. The levels are as follows. If the level of consensus achieved was between 100% and 75%, it was a strong recommendation. If the level of consensus was between 74% and 65% was a medium recommendation, and any consensus less than 65% was a weak recommendation. Bonnie Baker will now present the themes groupings.
Next slide. So the proposed framework for the top level grouping of the themes is illustrated here and includes 13 suggested parent modules. So as you can see, we have research principles, research methodology, protocol design, study setup, ethics, running the research project, community engagement, governance and regulation, research data management and sharing, research laboratories, the research team, study close, and research uptake. And what we mean by this particular concept is how to make a difference with your study findings. Now, just to help visualize and think through these grouped concepts, we've presented the modules here, viewing research as more of a dynamic system rather than a strictly linear process. So please note, we're not suggesting or emphasizing a particular order or a hierarchy to these modules. So with that in mind, let's now briefly explore each module presented here. Next slide. Thank you. So firstly, the module entitled Research Principles. This is informed by 9 themes, and we've listed the titles of all 13 parent modules down the left-hand side, just as a useful reference as we work through these. And as a reminder, the percentages next to each theme indicate the level of consensus reached by the Delphi panel to include these in the curriculum. And the color coding applies a level of recommendation for which the legend features below. So as you can see, all themes listed here under research principles met with strong recommendation for inclusion. And what we can also see is the level of consensus reached and expressed by the Delphi panel indicates a strong need for looking at the fundamentals of good research in the conceptualization stage, including the themes concept of health research, identifying a research gap, and the development of a research question. Next slide. So the next module is research methodology, and this is the densest of the module groupings with a grand total of 22 themes. And from the nature of these themes, participants indicated quite a significant focus on actually defining and understanding the remit of various study designs, such as clinical trials and epidemiological studies, as listed. And determining the most suitable and applicable approach to answer a research question was also apparent. So we can see this indicated here with 93% consensus achieved for covering the various quantitative and qualitative data collection methods, closely followed with strong consensus for the different sampling techniques. And what is interesting to note is the more moderate or weaker consensus established for certain fields of research, including methodology and health policy, social science and health economics, which you can see in the lower reaches of the table. In fact, health economics and operational research were among the 3 themes that scored the lowest level of consensus across all 108 themes, as determined by the panel. So again, we're moving through these quite swiftly for the purposes of getting to the interactive part of our session. And so please do refer to your briefing paper if you would like to reread or revisit any of these module listings. These tables were provided within that paper for your reference. Next slide. So the module for protocol design was informed by the following 5 themes, all of which received a strong level of consensus, above 85%, and speak directly to the core considerations that shape and inform the development of such a key document. So most notably recommended was identifying the target population and eligibility criteria at 94%. Now, this may feel like a short list when considering the parameters of the protocol and aspects that should be comprehensively included within a module titled protocol. However, these are the themes as determined by our participants, over 7,000 of them, and evaluated by the Delphi panel as to what is essential and must be included, but not necessarily limited to. So that's just very important to emphasize. Please don't interpret these groupings presented for each module as just a strict list of individual lessons, but as the concepts that were considered essential to include within each module. Next slide. So next we have a module labeled Study Setup that is underpinned by 7 themes. Study Setup developed from this series of themes that very much guide the practical steps for implementing a study. For example, developing the relevant site SOPs, the storage of research materials, and considerations for study-specific training, all listed here. Now, the Delphi panel also expressed strong consensus at 95% for including the theme related to the data collection tools required to capture the research data. And just to note, this theme fell within the top 4 most highly rated themes by the Delphi panel across the whole study. And also registering highly is writing a grant application with 87% agreement that this should be included. Next slide. So here we've grouped a total of 8 themes to inform a module centered around ethics. 7 of these themes are within a level of strong recommendation. Most notably at the top of the table are those aspects which are critical to the rights and protection of participants, with 98% consensus achieved for including the key principles of informed consent and assent, in parallel with participant confidentiality and privacy, which also scored 98% consensus. Now, registering highly was also the conduct and storage of participant data. So it was also determined important to include the definition of vulnerable populations and the ethical implications for programs that sought to target this population for the purposes of research, as we can see here with 94% consensus. So it's important to share that these top 3 themes listed here for ethics were the most highly rated by the panel across the entire study. And if you were actually to add up all of the weightings for all the themes listed here, the ethics module forms the strongest module from all 13. Next slide. So the following 6 themes are grouped to generate the governance and regulation module. And as you can see, the concept with highest consensus among panelists was monitoring and evaluation at the top with 87%, which is a key and critical component of quality management practices. Now, as a theme in its own right, research governance and regulation met with 83% consensus across the board of panelists, suggesting a strong need to cover the importance of the broad range of regulations and principles and standards of good practice that ensure high quality research. Now, interestingly, 3 of the listed themes fell into the lowest tier of recommendation, including quality management systems, audit, and medicine supply. So despite the strong consensus achieved for including monitoring and evaluation, in contrast, it's very interesting to note that the theme of audit met with such reduced consensus. And just to share a little further detail with you, the theme of medicine supply and regulation was identified by the panel as a new theme in round 1 of the Delphi. Next slide. So running the research project very much draws on and groups the 7 themes that speak to the project management aspects of a research study, with a focus on operational skills for effectively progressing the study through the various phases and milestones needed to reach a successful conclusion. And we can see here strong consensus for research project management and planning at 88%, as well as budget management and time management, both registering with 79%. Panelists also highlighted the need to consider mitigating circumstances, for example, outbreak scenarios, and how to plan for such situations that could disrupt and impact on studies, as indicated with 75%. However, most highly agreed is the need to include the principles and the importance of study reporting procedures and practices, which features at the top with 91%. Now, the very nature of this module could be considered quite strongly integrated alongside governance and regulation, with themes including the reporting of adverse events at 82%. Next slide. So obviously a critical and important topic within research, this module is titled Community Engagement, and a high level of consensus reached for all 5 themes listed here. The inherent theme of community engagement principles and activities was most highly rated with 84% consensus. And again, this module would not necessarily be strictly limited to those themes and concepts listed here, but as determined by the previous 2 stages of the study, participants indicated these themes are important and should be included. A further detail just for interest, the top 3 themes listed were rated by panelists as unclear in round 1 of the Delphi, and therefore required the provision of further definitions in round 2 for improving the clarity and the understanding. Next slide. So research data, management and sharing, a total of 9 themes, 7 of which place a strong level of recommendation and emphasis on data capture, the storage and management of the research data, and considerations for sharing data, as well as the analysis and presentation. So how to visualize your data. With 92% consensus, panelists strongly indicated that the definition of data quality should be included. With a moderate level of recommendation, the theme Principles of Big Data Analysis at 70% was a new theme suggested by the panel in round 1 of the Delphi. Now, it's also important to note that it really wouldn't be within the scope of the curriculum to cover a detailed exploration of the various software packages available for data management, such as REDCap, or in terms of data analysis, programs like R or Stata, but to offer the overview and core principles and the role that software packages can play within the field of data management or analysis. Would mean specific and advanced training would be required to get practical experience with any of these particular applications. Next slide. So the research team, a total of 10 themes, of which half were strongly recommended. This module focuses on the interprofessional and interpersonal skills within the workplace, really looking to optimize the dynamics within the research team, indicated by teamwork itself, rating highest with 86%, as well as clarity around the roles and responsibilities of study staff members, jointly alongside at 86%. Now, fostering collaborations also featured strongly with 80% consensus to include this theme, as well as guidance and principles for career development, registering at 78% consensus. However, less emphasis was placed on skills to underpin and strengthen leadership in research, as indicated at 67%, and correlates with the theme leading and managing complex research groups, which achieved the lowest level of consensus within this module, as you can see there at 57%. So from this, it's perhaps interesting to see again what is viewed as essential skills versus those concepts which are considered more advanced or specialized skills. And a lot of themes listed here originated from the formal gap analyses stage of the study, in which researchers gave consideration to the skills to support longer term development and sustainability of research teams. Next slide. So this next module, labeled Research Laboratories, contains a total of 9 themes, of which only 1 met with strong consensus for inclusion, and that was good clinical laboratory practice at the top with 79%. And the themes listed are very lab specific, with a focus on safety and handling practices, sampling, storage, and quality. Now, in contrast to the ethics module, which was the most strongly rated across the framework, as a module, research laboratories cumulatively achieved the lowest level of consensus across the panel. And although we had high representation of trialists on our panel, we had low representation from laboratory staff, which only equated to approximately 1%. Next slide. So study close is our next module and is informed by a total of 7 themes. Strong recommendations were expressed by panelists for guidance in measures to approach study conduct, particularly handling the data and samples appropriately at the end of the study, as can be seen with 87% consensus. However, within this module is also a keen focus on preparing manuscripts for publication. And from this list, 4 of the 7 themes are centered on the process and the skills of writing scientific papers. The scientific writing features highly at 86% consensus, as do considerations regarding referencing, with best practices for referencing and plagiarism at 87%, and the use of citation tools registering at 81%. Now again, just to offer a little further insight, the 3 themes at the bottom of the table, authorship in research, research registries, and intellectual property rights, were new themes generated by the panel in round 1 of the Delphi. Next slide. So this module is titled Research Uptake, and the meaning that underpins this is how to make a difference with your research findings. And 4 themes are included here to inform this module. Communicating research met with the highest level of consensus within these themes at 92%. There is also very strong consensus for upskilling researchers to engage with the science and policy interface. So really guiding and coaching researchers in best practice for effectively translating results into policy, as can be seen, with 91% consensus, as well as skills that guide steps for the tangible uptake of research into clinical practice, highly noted with 85% consensus. So with the lowest level of consensus at 56%, research indexing was again a new theme suggested by the panel in round 1 of the Delphi. And as an additional detail, we had only 1 panelist who indicated they were directly working in the field of research policy. So this is the final module in the proposed framework of 13. Next slide. And before we conclude this section, we just wanted to briefly share with you some limitations, because all good studies have limitations. And with an aim to have a globally representative sample in terms of geography, across our panelists, we had 66% from low-income countries and low and middle-income countries combined, which gives a standalone low-income country sample size of only 9%. We also appreciate we had low stakeholder input, and as Arantxa will share with you in a moment, we sought to address this through a stakeholder review workshop with this target audience. Within our sample, we're also aware we had high representation from researchers with backgrounds in clinical trials and epidemiological studies, and therefore underrepresented on those with experience in qualitative methodology studies. Obviously, due to the nature of the global pandemic, panelist recruitment was a little challenged and limited by the impact of COVID-19. And so we experienced some level of attrition of panelists between round 1 and round 2 of approximately 13%. And the final point to share is around the use and understanding of the term essential when describing and assessing the content of the curriculum, for which there appeared to be multiple interpretations. So I'll just hand back to Arantxa to briefly comment on the additional input that we sought from stakeholders who were given an opportunity to review the framework.
Thank you, Bonnie. So as Bonnie mentioned, In December, we conducted a stakeholders review workshop, and this was the reason for this. The rationale was as we had a low representation of stakeholders within the panel group, and this workshop focused on capturing stakeholders' feedback to complement the Delphi study results. This workshop was a joint collaboration between TDR and the Global Health Network, and as part of the workshop, we conducted an interactive session capturing direct input from the stakeholders. We asked them questions. Each question was presented with a yes/no answer option, and the stakeholders answered live, selecting their responses on the computer or device. Stakeholders were also instructed. We asked them to provide further details to support the choice, mainly for those that selected, if they selected no as an option. Our questions aimed at validating the grouping of the themes. That would be the potential module titles that Bonnie has gone through, and evaluating the applicability of this training to the global research community. On the first objective, we had the first two questions that you can see in the bars on the slide. So for validating the grouping, the titles of the modules, we asked, are these titles an accurate reflection of the content of the themes? And we had a 97% response of yes. Second one, does this address the key essential principles of the research process? And we had 100% yes from those that responded to the poll, the question. Regarding the second aim, our second aim, the global applicability of the curriculum, we asked, is this proposed curriculum globally applicable? And we had an 87% yes and a 13% no. And the second one was, would this proposed curriculum be relevant to all different types of research? And we had a 75% yes and a 25% no. As I mentioned before, we especially encourage stakeholders to give us the rationale if they selected no in their answers. Regarding the global applicability of the curriculum, participants who selected no raised concerns regarding how to adapt this training to different settings, particularly in low resource areas, and we will be exploring this issue in this workshop. And those concerned with the applicability of the curriculum to all types of research stated reasons, including, and this is a statement, one of the comments from the workshop, it says, skills and training needs are different for a team involved in research design versus a team involved in implementation of research. That would further vary across a team engaged in trials versus surveys versus qualitative research. Our response to that is our aim is to identify the basic research skills that would be required in any type of research, is to provide a foundation. This does not mean that researchers would not need specialist training for different projects. Overall, the workshop polling showed substantial agreement between the Delphi's panel's rating and the opinion of the stakeholders, and this provides further support for the acceptability of the curriculum as a global standard for health research training. Next slide.
Thanks, Arantxa. So that concludes our presentation, and we would really like to extend our sincere thanks firstly to all the participants and panelists who took part in this study and for generating such a rich pool of data to support the development of this curriculum, as well as to our funding partners who've given their support to the network and collaborated on this research project. So thank you very much. Next slide. So we'll now pause to address any comments before progressing on with the interactive session. So I'll hand back to Trudy and Pascal.
Thanks, Bonnie, and Arantxa for taking us through what's a huge amount of data, and hopefully everybody saw that before the meeting anyway, but we just wanted to obviously talk you through it. We've got a few minutes here if there's any questions, so do raise your hand or write them in the Q&A. What was great was to see all these questions coming through, which we've been trying to answer. If we don't talk them through now, please don't worry, please still write them on there, because we will take this forward into the report and we will address them in the report or on the text during the meeting. And so what we really want to move on to now is the valuable time that we're going to have letting you all discuss this. And I think this is the main purpose of this whole meeting today, really. Pascal, have you got any comments on the data so far, or should we move on to explaining the next stage?
No comment at this stage. I think I would like to. I'm really excited just to see the result of today, just to see what we can do.
Exactly. I hope everybody's getting that. You know, we've all been working on this for so long. It's great to see so many people at this workshop, and this is the exciting piece. So next slide, please. So this is the business end of today. This is why we're all here. And thank you for the comments already on this in the chat. So the original aim of this work was to say, if you were going to put in place a research study anywhere in the globe, and it could be observational research, it could be a clinical trial, it could be any form of health research. It might involve sample taking, giving an intervention, using a questionnaire, using patient data. It could be a single center, it could be a multi-center trial. But the point is that overall, everybody needs to have these same sets of standards to ensure that any health research study is safe and it's ethical and it's done in a robust way. And so that was the point of this research, to say, all right, that's not necessarily an easy thing. So what would be the essential curricula? And obviously, how do you equip that team to run more studies and to think beyond one study and begin to build a whole aim of embedding research in healthcare and being able to run any type of study that site should choose to do? And so what we've come up with now, as you've just seen, is this set of modules. And so there could be any number of ways of delivering those modules, right? It could be done as a huge, somebody kindly put in the, you could everybody could go to university and study that within a postdoctoral qualification or even a master's degree, because you could do it so much. But also, you can break them down into quite manageable, easily accessible, short-term training sessions that are either delivered face-to-face or they're delivered through an online course. Our intent is that we publish this curricula, and then people can go, any organization could take the curricula and develop their own training. And then, of course, we're looking to work with TDR and try and develop some tools that people can use and take from this. And really our intent is that it would be the perfect situation if there was a set of resources that are free, easy to access, and anybody could use them. And a really important context, and this came up in the chat just now as well, is that this might be for ongoing diseases that happen every day, managing maternal health, diarrheal disease, surveillance work for ongoing public health issues. But equally, if there's another disease outbreak or a new pathogen that emerges, and you needed to put in place health research capacity really quickly, this also could be a curricula that's used to very quickly deliver that whole skill set that's needed to run a study. And so what we're hoping is that through this discussion with you now, we can just have some ideas and directions from you all about what would work and maybe what wouldn't work so well in your setting. And with the way that the world is now, look at us working on Zoom now, obviously we can use paper-based online training modules, YouTube videos, webinars like this, online classroom sessions, supported learning in the regions, peer-to-peer training. It's all there, and any number of those mechanisms could be used. And so what we'd like to do is just to think about this curricula as a set of discrete modules that could be delivered collectively in one huge training effort, or obviously can be broken down. And it can also be broken down within a team. So you could obviously direct some of the training topics at your operational management team, some to your clinical team, some to your lab. And I also, just to pick up on something that Bonnie said a few times, and a few of you came up with in the chat, sometimes some of the topics came out that were scored quite low. And I think in my experience of setting up clinical studies for 20 years in different places, it's often the least popular ones that are quite low. And think, you know, I smiled when Bonnie said audit, and I'm, you know, if there's any auditors on this call, I've worked as an auditor and monitor, and it's, you know, we're not always the most popular people in those settings, but it's so important. We know that we have to do quality management and assure standards, but you can see how some people might rank that in a less positive way than other things they perceive as more important. But that's why as well we've not tried to put any hierarchy in here. And I've also really been delighted to see things come through this training, like supporting the scheme, the team, finance training, managing colleagues, communications, all those really important skills that are absolutely necessary to deliver a good project. So what we're going to do now is turn the second half, and we're bang on halfway through. This is perfect. Turn the second half of the meeting entirely to you all. So this is the time to do some work with us now. Bonnie's going to explain the polling system, and we'll talk you through each question. But think imaginatively and practically, and with the goal of that we can create some training resources that can implement this data to impart these skills and knowledge really anywhere. So ongoing studies that everyday diseases that populations challenge, through to working in emergencies and obviously disease outbreaks. So I hope that really explains what we'd like you to do now. And over to you, Bonnie, to explain how we're going to run this next element with you. So thanks, everyone.
Thanks, Trudy. So yes, we'll now move on and into our polling exercise. So as Trudy said, we're really very keen to seek your input for how best to implement this training effectively in various settings. And in an effort to explore this with you, we've devised 4 questions that address 2 key objectives, which you can see here on the screen. The first objective is to really determine the best mechanisms for delivering the training modules. And 2 questions will underpin this first objective. Question 1, which of the following online methods would work best for you in your setting? And question 2, what different forms of recognition would be valuable? The polling will then move on to address the second objective, which focuses on supporting locally relevant implementation of this training. So 2 further questions will underpin this second objective. Question 3 will be what would help you in delivering this training? And question 4, how could these modules be presented and adapted to integrate with or complement existing research training in your setting? So let's move on to the instructions for how you can participate in this. So shortly, the 4 polling questions will be presented one at a time. The question will pop up and appear in the middle of your screen. And for each question, a list of answer options will be displayed. So once all participants have had the chance to answer the question, we will share the results of the poll immediately with you all now, before moving on to the next question. And what's important to note, though, is that for those of you who select the answer option other, when asked any of the questions, we kindly ask you to use the Q&A box at the bottom of your screens to share your suggestions and any further details. So let's begin. Next, lovely, thanks Sinead. So I will just launch the first polling question, which should be appearing on your screens now.
So the idea of this one, thanks Bonnie, is this is a very practical question for you, obviously, and now thinking about this online, which would be the most helpful ways that you could use this through to all of the others too. So this isn't about saying pick one, but absolutely choose which ones you think would work. And so, you know, we're all used to working online now, aren't we? And you can have everything from short online courses through to a whole toolkit you can download as, you know, maybe paper-based, then you can share with your team. You can use case studies and scenarios. Interactive sessions are really popular. We find now these workshops like today, And then the obviously things like YouTube videos and such like are also very popular. So just have a look down that list and tick all that would apply. And then overall that enables us, we'll have a nice, there's so many of us on the call, we should get a nice, and it's okay if they all come through as well, because I hope I can just make the point that what we really want to be possible from this is that any number of tools could be developed. And also somebody kindly put in the chat about that often it needs to be locally adapted, and that's absolutely right. You know, the intent here is to have a recommended curricula that people could take and work in their own settings and adapt to their own settings, but they can still achieve the whole curricula. And if they did manage to teach the whole curricula, then they would have covered everything they need to in assuring safe, ethical and quality studies. So hopefully that's quite straightforward. So have a look through that list and just tick any ones that would work for you for delivering training like this in your setting. How are we going on the voting, guys?
We're doing good. We're doing good. Again, just to re-emphasize, few participants have selected other, which is brilliant, but please do share with us your suggestions or any further details to support that in the Q&A. So we've had about 73% of participants vote.
It would be lovely to hear from all of you. And I think what's interesting is running a workshop like this in the year we've all had working online relative to what this might have been like a year ago, when we might not have envisaged that we can all work so well together and have tools like Zoom that are so accessible. But even things like mentoring are perfectly achievable across different organizations and continents now. And we've all seen how using different mediums like video, YouTube clips are working so well, even for things like clinical diagnosis. So they work really well in training. And on the Global Health Network, we have many little short courses that so many of you have already taken, and they're our kind of go-to, and they work very well as well. So just have a think about which one of those work for you. So once we've, how are we doing on the percentage now, guys?
We've hit 90%. So
oh, that's fantastic. Okay, we'll just give it a couple of minutes. And I think the short online learning sessions that many of you have taken on the platform, that would come under item number 2 within there. That's a sort of pretty much standard online short course, I think is what we mean by that one. Just to be clear, because I think that's probably the sort of standard way of delivering online training is a standalone short course or a lecture. So that would really come under there, and through to the more creative methods we've all had. And of course, it's good to have an online course that can then also be downloaded and adapted and used for your own settings. Good. Are we going to do the big reveal for each one as we go along, or should we wait till the end?
Yeah, no, I'll just end this polling now.
Oh,
so everyone...
How exciting. We need a drum roll now to see what how you all voted. This is live science, we're calling this.
And here it comes. I'm just going to share the results with you.
Right. Drum roll. Hold your breath, everyone.
Here we go.
Very good. Oh, interactive sessions. That's interesting. Very good. Very good. Mentoring always comes out. Excellent. Well, what I'm pleased to see is there's a really nice spread across all of them. And that's what we definitely find with the resources that we offer on the Global Health Network, that different systems work well for different people. So that's great. Really helpful and interesting. And of course, still time to write in the Q&A if you've got any comments you'd like to make to that, or anything, any of you that voted other, please tell us, because we'd love some more ideas here too. And obviously the point is we're going to publish this in a report and a paper, and we want people to be able to take this and develop their own courses based on this evidence. Good. Okay, let's move to the next question. Everybody's warming up now. We'll have 100% reply on this one.
Question is launching now.
Excellent. So this is a really interesting and important point. We have a lot of feedback around this. So if you do an online course, it's quite nice to know who put that course together, and also have a form of a certificate. So you take the course and you're maybe given a score, and you might, because there's been a quiz, and you would be given a certificate. So that's a very standard form of having a recognition. Of course, it could be that that no form of recognition is felt important, but it does seem, especially if you're developing a training record, it's good to have something. And then you can also have either on one course or several courses, whether you've done a score on all of these, on how well you've done. So you can have more than just a sort of percentage of a pass rate, but you could have some sort of tier system. Also, you could go a step further then, and that certificate is recognised by the organisation that's provided the training, and sometimes it's a consortia as well. So that could be the funding partner, it could be a group of organisations that have worked together, and lots of the courses that we recommend, that we give on the Global Health Network, have been brought together by a consortia, and we have all those institutions listed so you can see who they are. So that's quite key. Now, somebody has mentioned on the system already about whether or not you could bring all of this together, and you could offer this as some kind of educational qualification, which is of course possible, that you could take these courses and turn them to collectively and teach them at a very deep level, and this could work towards some form of qualification with a recognised university, and so that's possible too. And of course that would lead you to taking a course that maybe because you can have a short course that's run by a university, so you get a proper certificate from a university, or indeed the next step would be even working that all together to an actual qualification. But of course you might think of something different as well, and so please tell us. And again, with all of this, it would be, there's no reason why all of these could work, because standalone short courses are very useful for rapidly delivering training to teams in remote places where it's not easy to travel. We want them to be free and open access, and anybody can jump online and do a short course and ideally get a certificate. And then the other end of the spectrum is that somebody could do an online diploma or even attend a course in a university to get some form of certificate from some form of course. And so all of these are possible. And the point is that this is, evidence-led curricula that now people can take and adapt. So really keen to hear what you think about what are the most useful ways that you could see this curricula being presented by any organisation, because any organisation could take this curricula now and develop their own courses and training. So how are we going with the voting on this one? Is everybody warmed up now?
So we're up to 81%.
Woohoo, come on, the last few. We can tick. As I say, it's we're quite keen that any of them or all of them might apply. And please do give us some ideas if you have some thoughts of some others. It's quite nerve-wracking doing the big reveal because we never know what people are going to say, and this is the point, isn't it? And as I said earlier, this will be written up as a report and also published, and we hope this is then a really valuable evidence-based guidance document that anybody can use. Okay, are we ready for the big reveal on this one?
Okay, thank you everyone. So I'll just share the results with you now. It should be appearing.
Excellent, good. That's a nice spread too. So that the 8 of you that have kindly ticked other as well, please do write on, because this is where it's really interesting to get some new ideas about what could be done here. The certificates come out time and time again when we get asked about training as well, so that's good validation of what we understood to be true. And the recognition by a trusted organisation is good. And yeah, it'd be lovely to think about how this could be turned into some actual recognised courses and qualifications by any university. This is what I'm quite excited about. This could be taken up as a curricula to implement anywhere. Good. Okay, how are people writing on the Q&A with their others? So that would be good. Right, next question, Bonnie. We should start a game show, you and I.
Okay. So question 3 is just loading. Thanks, Sinead. And it should be launching.
Our glamorous assistant.
Appearing right now.
So yeah, this is the sort of getting down into the nitty gritty now about really what makes this applicable. So we're thinking here about every different type of setting. You know, sometimes there's really wealthy, well-resourced research centres with their own training teams, or you could be working with external sponsors that have got lots and lots of resources, or this could be trying to deliver this training in somewhere with got very limited resources, hardly any research experience, but you know, really want to get started in becoming active in research. And for them, how could this be really made implementable in, you know, to everybody in that team? So frontline health workers, community health workers, lab staff, nurses, clinicians, the administrative operational team, everybody. So how could this training be delivered in every setting in a way that makes it accessible and relevant and appropriate? So obviously language is very key if this is going to be truly globally relevant. Would it be important to be delivered by somebody who understands and has got experience? And so if we're talking about somewhere with little experience, would it be good to map on some help with some other sites with more experience and do some pairing with site exchanges maybe? This also brings back the mentorship scheme, where you can help deliver training between experienced and less experienced, both individuals and at a sort of centre level as well. You can have mentorship programs helping less experienced programs, and of course you can have mentorships between the individuals. Something we've been looking at with several groups we've been working with recently is about access to experts, because some of these courses, if you look at the whole curricula, it may be that some of them are quite straightforward, but some particular aspects may be community engagement, for example, or statistics, finance management. It might be that you need a bit of help in certain expertise. So let us know this. And also, we keep coming back to networking and accessing peers and other colleagues, so people who've already had experience in setting this particular skill up in their site. Training the trainer is an absolutely old favourite, isn't it? If the best way to teach is to learn, and the best way to learn is to teach. And so this can be really nice too. And I think having a set of resources where they can be downloaded to train the trainers, and then those trainers can implement them perhaps face to face, could also work really well. So just some ideas on, you know, one end is, you know, standalone online courses that people can log on and do by themselves. What's a sort of minimum achievable way to make that work, through to, if it is possible to layer in some wider support, what would that look like? And so the other box might be quite helpful here too, because I'm really hoping that there is some ways here to really think about how research sites with no previous experience might be able to implement this training, even with minimal support. So what would be the most useful things to get this taken up in the most difficult to reach and accessible places who've got no previous research experience? I think that would be my difficult question I put to you all there. So feel free to write in your thoughts on that in the other box. Great. Bonnie, how are we doing on that?
Really good. Yes, 89% at the moment. So
good. A couple for any more. You know, it's very complicated. I've worked for over 25 years in training research teams how to undertake health research, and there are so many difficulties to overcome. And so this is about things that we can change, I guess. Things like institutional support, funding across the whole nation, maybe to support research, things like internet connection, all these things are really part of this. And we've had that feedback already through this research. But what we're trying to do here is to think of some really practical, achievable solutions. You know, the things that we can change rather than the things we can't as easily, perhaps. So do think about that and pop your answers in the other box if one of these doesn't necessarily apply. So if you were going to go tomorrow to a place where they'd never had any research experience before, and you were going to deliver this lovely curricula for them to help them get going, what would help you in delivering that in that setting? So feel free, even if you've ticked all the boxes, to type something in for the Q&A piece. Good.
Okay.
Are we there?
Thank you, everyone. I'm just going to end the polling. And I'm just going to share the results with you now.
Oh, look at that. A trainer trainers. That's interesting. We should have started doing our bets before this came on. That's really great. What I like about these answers are how even they are. That's really interesting, really helpful. I'm not managed to keep up myself with tracking the Q&A, but really good if you've got a few more people wanting to just give us some other ideas in there as well. But that's excellent. And yeah, language is so important, isn't it? Good, fantastic. Thank you, everyone. That's super helpful. Let's do the next question, please.
Okay, so just launching the last of the polling questions now. It's question 4. Thank you, everyone.
Yeah, we're saving the hardest question till last, aren't we, Bonnie? So it may well be that in most places, even the most inexperienced setting would have some form of staff training, even if it's not even about research, through to really well-established centres of excellence that do every type of research. They've got beautiful labs, they run district surveillance, they run clinical trials with sponsors, and I know some of you are on this call who work in places like that. So it may be that you've got the sort of super duper state-of-the-art training facilities and schemes already in place, or it could be completely down the other end of the spectrum where it's there's training for healthcare delivery, but there is no research training as yet. And so can you think of this training curricula as a separate group of 13 modules, I think it is, isn't it? How the modules could be integrated or complemented with the existing research training. So when we were talking about this, we were thinking that maybe research centres could look at the training they're offering now and map this curricula with the training they're giving and seeing if there's any gaps. And obviously this curricula might be used to fill those. And often they would be in perhaps things like finance management or community engagement, or there could be some key areas where there is that gap, audit and quality maybe, or the other way around. You know, is that a useful thing to think about? Or would it be used? So, and this for people who will then take this curricula and turn it into usable, implementable tools. This is also asking the best way to present it. So if we think about these as individual modules, would having the training compartmentalized like that be really useful so that it could be implemented and slotted into existing training plans, or even starting from scratch with a training plan? But equally, then it might help, you know, to think about it according to the stages of the study. So having those modules set out as, you know, setting the question, designing the protocol, study implementation, study close, reporting, data sharing, engaging the research uptakes with the community, you know, thinking it through in that stepwise way. I think career development is really important, and thinking about the individual as well as the team. And so if some organizations have got really nice career development schemes in place, or there are some career development schemes that exist, and so could this training be linked to those so that you can see in an individual or even in a team that some or everybody have done these whole set of courses, and you can link it to show their the competencies and skills that they've developed relative to that curricula. And then obviously making the materials really flexible and adaptable. And this comes back to the point, I think, about making resources that are adaptable to local contexts and settings. And that might be the type of research they're doing, that might be the clinical setting, it might be as simple as language, but it would also mean about making it adaptable to dovetail into whatever training exists already. We've got the language question again here, which is so crucial. And of course, you might have really great suggestions that we haven't thought of. And really, this is the point with all these questions. We're putting our suggestions to you, but we really want to hear from you, because there's obviously things we've not thought about. And this is why we want you to do the hard thinking for this bit about how this could be usefully implemented. So this question is about this adaptability, accessibility, splitting it up into manageable chunks, and how that might work best. So how are we doing on the voting there?
Yeah, really great uptake, 91%. So
oh, they like this one. Excellent.
Yeah, thank you everyone. It's brilliant.
All right, let's have a look then. Let's see.
So I'm ending the polling. Thank you everyone. And the results should just be presenting on the screen now. Fantastic,
excellent. Well, a nice mix again there. Oh, good, we've got 15 others there. I hope there's 15 lovely ideas written in the Q&A there. And trainers coming through again, really useful, really good. Excellent, that's super helpful. I'm really looking forward to reading those Q&As later and seeing what's coming through ideas-wise for that. Good. So now we've really warmed you up. It's time for the sort of, this is our last question, isn't it, Bonnie? But it's the hard one.
It is.
We want everybody to do some work for this one, because there isn't a poll, I'm afraid.
No.
So this comes right to where we're all living and breathing now. And so this is important. But I'd like to contextualize this a little bit. So obviously, in an outbreak, there is an immediate need to answer lots of questions all at once. There is a need, firstly, to have the ability to spot a new outbreak. Then it needs to be characterized, understanding what the new disease looks like and how it presents in the patients, what the transmission is, what the symptoms are, and just really understand the mortality and what's going on. And then, of course, you get into trying, the most effective ways of diagnostics to spot these outbreaks, and then also to obviously then move on to interventions, be it public health interventions or clinical to manage the disease, or obviously hopefully treat the infection, and finally things like vaccines. In any other disease areas, of course, this is exactly what research happens every day over decades, though, where you have all those different types of research in that ecosystem. So we've got surveillance, we've got observational studies, we've got social science and anthropology, we've got clinical trials, we've got health economics, and normally they happen over decades by different teams, and you have this slow evolution. I think it's a really important concept to get across. We often all talk about people being about research preparedness, and that we need to train people to be able to respond to an outbreak. And I think a lot of us actually feel that what's maybe a better way to look at this is to say, well, in places in the world where there isn't abilities to do research now, actually, if you embedded the ability to undertake health research for everyday diseases that are the research priorities for those communities, so normal things that many places battle with, maternal health outcomes, diarrheal disease, respiratory infections, all the normal daily public health challenges. If you can implement the research capabilities to respond to those everywhere, then they're active in research, they know how to collect data, they're familiar with working actively in research already, and then they're able to respond to an outbreak. And indeed, they'll be there to if you don't have that there, then outbreaks can go unspotted and then gallop away before we've even had chance to characterize it and contain it in that one place of the outbreak. So obviously outbreak is on everybody's minds now. but I think a lot of the discussions that we've all been involved with around this has been not taking our eye off the ball for ongoing disease burdens, be it malaria, TB, HIV, malnutrition, you know, everything else. And there's this difficult trade-off while the world is obviously so taken up with COVID-19 that we just contextualize outbreaks with an ongoing need to do research. So this is a really important question. And I'd just be really interested to hear all of your thoughts that how you could take these modules and implement them in the context of an outbreak, but maybe thinking about it in that wider sense of actually embedding research capacity in places where there isn't any existing abilities right now. So we did save this till last because it is the hardest question and the most detailed, but we've got the most fantastic group of people on this call who are, every single one of you is able to give us some really insightful thoughts on this. And so this does require you to get typing in the Q&A. And obviously we're not going to just be able to show the results, but we are really interested to hear if you know, we've showed you this curricula, we've thought about how we can turn, any one of us could turn this curricula into training courses and deliverable schemes in the consortia that we're all working within. But just to step back a bit and think, can these modules be used in some form of toolkit that you could take into an outbreak context? So how can we think about that in terms of delivering ongoing research capacity when none exists, right through to, okay, well, there's never been any research there before, but can we take this in some form of deliverable toolkit that could be imparted to a team and could be implemented in that kind of all at the same moment sense that is required in an outbreak? Because above and beyond all of this, this is all about ensuring that any health research data is ethically collected, is safe, and is robust, and so high quality and reliable. So I think that's really explains that. I don't know how we're doing for the numbers of answers we're getting, but you've all got time to keep typing while we carry on the discussions. But anybody from the team, would you like to add any more to that final question or gaps we've had from before? Pascal, is there anything you'd like to add to that?
Not really. I think you summarized the fact very well.
Good. Well, we're intrigued to see all your responses. And just to say, you know, we will be writing this. This is going to be a report that TDR share on their through their platform and on the Global Health Network, and we will be capturing all of these responses. And so it's, you know, it's an important opportunity for you all to share your thoughts. Good. Okay. Well, thank you everybody for working so hard for that session, and we've got some brilliant responses coming through. So do you think we've got enough to move on?
Yeah, there's some fantastic suggestions coming in and comments. Thank you, everyone. It's so valuable.
Good. Keep them going. Lovely. Okay, can we have the next slide then, please, Sinead? Good. So the next steps then for us will be to write this up and put it in this formal report. And as I say, it's followed on the back of all of this incredible piece of research that's happened, and many of you I know on this call were part of the Delphi or part of the original surveys, and so I hope for you you've really enjoyed firstly being part of this journey with us, and the team are incredibly grateful for all the input. I mean, literally, I think we've had about 7,000 people be part of this one way or another, so it's really exciting for us to get to this final stage. And you know, within the Global Health Network, we're going to be working to try and complete, you know, listen to all the responses and develop tools and resources to implement this training. TDR are going to be working with us and with others to take this on as well. And also the whole point is this is an evidence-led curricula that anybody can take and use. And so we'd really love to see this being applied as widely as possible. So feel free to add anything else you can think of that makes this more achievable for us. So I'd just like to pass to Pascal to get some thoughts from him.
I think it was a really fruitful discussion on what I heard about the panelists. If that the curriculum could be implemented as interactive materials, either online or face-to-face, but it should be interactive, linked perhaps with some mentorship or some access to experts. The curriculum has to develop as modules and adaptable to local needs. And even if it's not really appearing as a big challenge in the pool, I think if you are looking at the chat, I think the language is a very important one. And the certification of this curriculum could be linked with the career development, which is really important. And what is really important with TDR, it's in the online onto what this TDR is doing in the needs of the trainer curriculum. So we have the skill building course, but we will have to develop a train the trainer, which is good. And I really appreciate also in the chat the fact that for an outbreak, I think we have to think about to develop team spirit, and just to identify and perhaps beyond the team to work with the institution, just to be ready for an outbreak is good. But I think it's really great success, great results, and I could say that now, Trudy, we have to work together just to try to implement this curriculum to be used in the fields by our panelists here, and just to not the panelists, but the participant to this workshop. And thank you again.
Thanks, Pascal. Yeah, absolutely. I think we've definitely got our work cut out now, haven't we, to try and take on board all these comments and come up with some tools and resources that cover all these different suggestions. But we also throw that open to many of you on the call here who perhaps work in the settings too, and you can work with us and also adapt and use these as you wish as well, taking on board these suggestions that we've got here. I really liked a couple of things that you just said there, Pascal. The train the trainer piece is so critical, and I think that can be widened to think about the trainer doesn't even need to be a trainer in your institution, does it? It can be, the trainer can be in a collaborative site somewhere else, and lots of these initiatives around getting nurses to work together or laboratories to share best practice. You know, the trainer can be remote, and we can really extend that principle of train the trainer, which I think is really exciting. And this message of collaboration and linking up organizations and getting organizations with a huge amount of experience to share their know-how with groups with less is really key. And then the other thing that I think has really come through this afternoon is the importance of the team. And I think in times gone by, there was often a focus on training the clinician in charge of a project or the PI, and they'd often be taken off overseas to somewhere lovely and be given a training course on a protocol. And you know, those days have gone, and I think the whole team has to be valued, because every member of the team is a scientist, and they're all working to answer the question of the study and make sure the study succeeds. And so even if it's whether you're the clinician or the accountant, your role is still making sure that the study can operate and work and can answer the question and be completed. Because if any of those elements fail and the study fails, because you weren't managing your team or your protocol properly, that's impacted the science. So everybody's role is of value and equally important. And I think this, having the whole team bought into the spirit of the research and everybody's role in having safe, ethical and robust data is really key. And so I think that that element of team spirit and training a whole team has come through this really strongly, which is really, really exciting. The other point, and I do think it would have been interesting to have done this meeting a year ago and then doing it now, is how much online resources are useful for this, and that there was a lot of reliance on face-to-face training in the past, but obviously not everybody can afford to travel to get face-to-face training, or it would be requiring to ship people in from overseas or another site to give that training, and that's just not necessary anymore. You know, there's an awful lot that can be achieved through the really wide variety of mechanisms and tools that are available online now, if you can get people access to screens and connectivity. And so that's part of some of these issues as well. So I think we're concluding this now, and it's been amazingly valuable, just the contributions we've had. And I wonder if there's anything else that any of the team wants to add before we close.
I think just to reiterate our thanks again, especially to all of our Delphi participants. It's been such a pleasure working with you across the whole process, and we will follow up with you obviously after this workshop, and just delighted that we had a chance to form such a significant and meaningful consortia with you. So we look forward to progressing this and keeping you informed of the next steps, and for your help with such a significant piece of work. Thank you.
That's great. So I think we've got one more slide there. Yeah, this has absolutely been a remarkable team effort in the biggest sense of the word. A lot of this work we conducted through the consortia that we're working with across Africa, Latin America and Asia. And we've got the networks that have been run through the EU, which started off looking at Zika, and they've spread so far much wider than Zika, which has been wonderful. And that's the EU funded Zika consortia, through which READY was set up as a capacity building network. We've also been working through the EDCTP funded networks in Africa, which are Alert and Pandora, and also the EDCTP networks of excellence, who we've long worked with and absolutely thrive on our partnerships with them. And of course, through all this, we've worked with TDR for the whole decade that the Global Health Network has existed, and you know, we absolutely value that partnership so strongly. And between all of us, we've been supported by the funders that you can see here as welcome, the Bill and Melinda Gates Foundation, the EU and EDCTP. So as I say, this has been, you know, over 7,000 people have been part of this between them. And so this is the final step, but it really brings it all together. And so we're really grateful for everybody's involvement. And we urge you to look out for the report and obviously work with us to take forward these findings, so that we can all work together to implement these skills across all the places in the globe where the ability to collect evidence is not there. So we'll close there. Pascal, I'll just pass to you to close the meeting.
No, I would like to thank, on behalf of BTDR, all the participants for their re-involvement, because I'm really not surprised, but with all the results that we have in this, with this workshop, I think it will help us just to implement. And I think it really the Global Health Network and the TDR will come back soon just to inform you how are the best way just to implement this curriculum for you to use as soon as possible, hopefully outside an outbreak for the first one. Thank you very much.
Thank you very much, everyone. Really grateful for your time today. And thank you, team, for running it so well in the background. Thanks, everyone.
Thanks, everyone. Thanks, Trudy. Thanks, Pascal.
Thanks, everyone. Bye-bye.
Thank you. Bye-bye.
Thank you.